I get a lot of requests to discuss gender affirmation surgery. So in this video, we're going to react to an episode of Skin Decision from Netflix. And on this episode, a young transgender man undergoes top surgery. Let's take a peek.
I'm happy to now be Atticus. Coming up on my second year in transition, and I can say, like, full confidence, I love my body. It's just, I want to change it. There's things about it that I want to transform.
So Atticus has been on this journey here for the last 2 years of transition. And a lot of people ask, how long do you have to be on testosterone before you undergo top surgery? And typically some surgeons wait anywhere from 6 to 12 months. This allows the testosterone to affect the body and to actually help to reshape the chest without undergoing surgery. That being said, it's technically not mandatory to be on testosterone before undergoing top surgery, but a lot of surgeons find that the results cosmetically are better if they've been on testosterone for a certain period of time.
I'm so excited to say goodbye to rug burns under my arms from tape, purchasing the tape, and oh, I'm so stoked for all of that to be a thing of the past.
Gender confirmation surgery is the blanket term given to operations that are performed when somebody is transitioning. When we talk about top surgery, which is what's covered on this video with Atticus, those are operations to either reduce the size of the breast or do the opposite and do a breast augmentation. These types of gender affirmation surgeries are typically very, very positive for the patient. Some surveys have found anywhere from a 94 to 100% satisfaction, and one study found that about 3/4 of those patients who undergo gender affirmation surgery say that they have a higher quality of life after the operation.
My number one goal is that first moment with my feet in the sand and I just take my shirt off and I feel the sun hit my chest for the first time since I was 6 years old.
That really strikes me, and that, you know, in our lives there are certain things that those of us who are cisgender may take for granted. You know, just the act of taking our shirt off as a male and having the sun hit our chest. I mean, it's something that as a cisgender male, I haven't honestly thought about. So for him to want something that is so simple yet so beautiful, I mean, why not give it to him?
It's only because Jessica, who was so lost and so hurt and so defeated, looking at her, I have much appreciation. Because if it wasn't for Jessica, then Atticus would not be sitting right here.
I always think of life as being a journey, and Atticus appears at his young age to have undergone quite the journey. But I'm so happy that he has gotten to the place where he is now, and I'm also very excited for him about what lies ahead in his bright future.
So tell us what brings you here.
Well, every morning I wake up, it's pretty much the first thing I think about is, are people gonna notice that I have breasts instead of a flat chest? It's something that throughout the day I think of as well.
So Atticus is seeing actually a good friend of mine, Dr. Sheila Nazarian. She's a board-certified plastic surgeon in the Beverly Hills area who is the star of this show, Skin Decision. She has a massive following on Instagram, and I'm so happy that he has chosen such a renowned, fantastic doctor.
Mentally and emotionally, dealing with trying to figure out my identity was excruciating at times. It's a miracle that I'm here today, it really is. I got to the point where I didn't want to be here anymore. There were a couple times where I attempted to end my life.
The amount of depression and suicide in transgender teens, whether transgender males or females, is really, really concerning. There was one survey that found that literally 50% of transgender male teens have tried to commit suicide at some point in their lifetime. This is in addition to 30% of transgender female teens who have attempted suicide as well. This statistic is so concerning that I am so glad that there has been such a light shined on this issue, both from medical societies like the American Medical Association, the plastic surgery societies like the American Society of Plastic Surgeons, and even the mainstream media. There's so many celebrities who have spoken out about this and the importance of supporting transgender teens because of the profound amount of suicide and depression that they undergo. It is not okay.
Atticus is here because he wants his gender-confirming top surgery. And there's no way to do that other than with cutting.
This is true. When you perform top surgery from a female to male transgender patient, essentially what we have to do is remove excess breast tissue and sometimes excess skin. In order to get at that breast tissue, it's not as simple as just liposuctioning it. Some people think, oh, you can just liposuction because isn't the breast mainly fat? Well, not necessarily, especially in somebody this young. There's often breast tissue that is so thick, it has a consistency of styrofoam. In order to remove that breast tissue, you have to cut typically an incision around the bottom part of the areola to actually cut that tissue out. That does create a permanent scar. This episode is brought to you by my skincare line, Youn Beauty. Our products combine natural and organic ingredients with the latest in scientifically proven anti-aging components like vitamin C and retinol. So if you're looking for healthy and youthful skin without the unnecessary chemicals, this is the skincare line for you. Check them out at dryounonline.com and use the coupon code 20OFF to get $20 off your first order over $99. We'll put a link in the caption below. All right, back to the video.
Before we do anything or talk about anything at all, I just want you to pick up those goggles and take a look.
All right. Let's see. Got here. What? No. Oh my god. Oh my gosh.
Crazy technology.
I love it.
That is so cool. I love how they're able to do that for him, and he can actually look down and see how he will hopefully look like after the operation. We are using so much more of this type of virtual reality, 3D imaging, and things like that in our plastic surgery practices.
Every wish I've ever made, every penny I've ever thrown into a fountain, all those accumulated are what equals this major, huge wish. It's just gonna be a breathtaking moment.
This is a huge step for Atticus. This type of operation typically is done under a general anesthetic where you're completely asleep for it. So basically they put an IV in you, they inject some medications, get you completely asleep, the operation is performed, and when you wake up, it's over.
And this is so I can get a little bit of fat to transfer in the upper part of the pec muscle to make Atticus look like he has more muscle mass. So I don't know if you can see the actual yellow fat cells floating.
So Dr. Nazarian's first step is to take a blunt kind of a liposuction needle and to by hand suck out a certain amount of fat from his breasts. That fat is typically spun down in a centrifuge and then the fat that is remaining is pure fat. That fat is then injected into parts of the chest to help reshape it.
So now I'm going after the gland and I'm also thinning out the nipple. And this part also, when you take the bottom part of this areola out, takes away that puffiness of the nipple.
The second step is to remove that tissue that's right below the actual nipple and the areola. So we all know what a nipple is, but the areola is the colored circle surrounding the actual nipple. And that whole area is typically puffier in women than it is in men. And so by removing that tissue that's right below the skin, it can help to flatten that nipple and areola out.
Now what I'm doing is going into the actual breast tissue to remove the gland itself. Here it is. That's his breast tissue underneath. I'll take off a little bit more.
So after removing that tissue right underneath the nipple and the areola, now you can see she's removing the actual breast gland. And this is the same tissue that produces milk in a lactating woman. This is not tissue that you can suck out with a liposuction cannula, although I have actually in the past used an arthroscopic shaver. And this is a device that basically is a swiveling knife at the end of a long tube that can help break that tissue up and suck it out. So there are a couple of different ways to achieve the same result here.
I'm gonna move on to placing the fat into the upper areas of the chest to really build that area out. Just putting in a teeny bit of fat. So much better. Oh.
About 50% of the fat that is injected into the breast area like that should stay long term. And obviously the other thing that Atticus can do to help to strengthen and more masculinize his chest would be to do a lot of chest exercises like bench presses, push-ups, and flies.
Can you see? Still swollen, obviously, but. Why are you crying?
I'm so happy.
Oh, I'm happy for you.
It's so great to see his reaction right after the operation. Now, he might be a little high at the time, but I'm still happy to see that this is such a transformative thing for him. And I mean, he really does deserve it, as do we all, to be happy with our bodies. Now, if you or somebody you love is considering gender affirmation surgery, it is so incredibly important to find a plastic surgeon who specializes in that. There are little nuances of the operation that are only known by those plastic surgeons who truly study these surgeries, and you don't want somebody who's kind of dabbling in gender affirmation surgery to do those operations for you, ideally.
Taking my shirt off on the beach was my biggest moment of freedom that I've experienced so far in my life. To anyone out there who's scared to live their truth, stop. Don't tell yourself you can't. You gotta say, I can, I will, I am.
Thank you so much, Atticus, for sharing your story and for being such an inspiration for so many people. And I gotta give kudos to my buddy, Dr. Sheila Nazarian, for doing a fantastic job with his operation. Well, Dr. Nazarian is one of the really good plastic surgeons out there, but there are a lot of bad doctors out there too, botching operations left and right. Take a peek at this playlist right up here where I react to episodes of Botched, where you can see people who undergo operations to fix things that will blow your mind. And if you've been enjoying my videos, please subscribe to my channel. And always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.